A number of studies have come out in the last 10 years about phosphatidylcholine as a new therapeutic agent for ulcerative colitis or Crohn's disease. Here's one from Gastroenterology 2013, April. Z Gastroenterology, I don't know what that Z means. Hopefully you can see that. And it has a very positive response on it. The data indicates the essential role of the mucus phosphatidylcholine content for protection against inflammation in the colon. Higher phosphatidylcholine in the mucus gets rid of that inflammatory component. What we're really talking about is PEMT here. It's because these kids can't make phosphatidylcholine, or these people cannot make phosphatidylcholine. That's PEMT that causes that ulcerative colitis, Crohn's disease. L18, now 19 of my I had another one today. 19 patients with PEMT that have phosphatidylcholine problems. Here's another one. Phosphatidylcholine is effective for treatment of ulcerative colitis, a meta-analysis. Digital Digest 2021. Phosphatidylcholine is intrinsically missing in intestinal mucus of patients with ulcerative colitis. Phosphatidylcholine containing lecithin, which is what's in our glutathione actually, too. But this is the phosphatidylcholine I like from Designs for Health. You can see the link to both these below. This is our virus glutathione. We have patents all over the world on it. It's the only validated, patented oral glutathione ever. This is phosphatidylcholine. You can take up to 4 of these a day, or 5 even, to be equivalent to some of these studies of 2 grams a day of phosphatidylcholine. But if you're taking the virus glutathione 3 or 4 a day, you want to take like 3 or 4 of these a day. If you're really bad, if you're having a flare. Phosphatidylcholine containing lecithin products improves clinical and endoscopic outcomes of ulcerative colitis and quality of life in patients too. That was in 2021, actually, so there it is. Exploring the phosphatidylcholine in inflammatory bowel disease. So this is more about Crohn's disease, but it's the problem with both of them. Those patients can't make phosphatidylcholine, and it's from current pharmaceutical designs or descriptions. I can't tell what that means. DES 2022. Phosphatidylcholine plays a significant effect in the treatment of irritable bowel disease inflammatory bowel disease, by modulating gut barrier function, remodeling gut microbiota structure, and regulating polarization of macrophages, and reducing the inflammatory response. That got me thinking more. We'll talk about the inflammation here in a second, but it does help. Phosphatidylcholine for steroid refractory chronic ulcerative colitis, a randomized trial that was a huge success, 2 grams per day. This was from Annals of Internal Medicine, November of 2007, big journal. They were taking 2 grams a day. The follow-up rate was 97%, 60 patients, and a bunch of also controls. And they had great results. They reached endpoint with all of them, meaning they had huge benefits with all of them. Phosphatidylcholine doesn't have any side effects. It's easy to take. And there's some other things I'm going to give you tips on that bring down the inflammation further. We talked about the glutathione. We talked about the phosphatidylcholine. We're going to talk about our varsod, which also should be thrown in too. Anything you can do that's natural to reduce that gut inflammation helps. But the phosphatidylcholine reduces corticosteroid dependence more than placebo in patients with chronic steroid refractory ulcerative colitis. So here's an article, here's a PubMed research on glutathione and ulcerative colitis, 455 articles. 455 articles. Glutathione helps reduce that inflammation a lot in the gut. So the virus glutathione, plus ours contains more phosphatidylcholine. You want to take 3 or 4 of those a day, 2 or 3, 4 or 5 of those phosphatidylcholine a day. And NAC. NAC is a big deal. Here's an article on NAC. You get big improvement in Crohn's disease and ulcerative colitis with NAC too. This stuff is crazy. Here's a good article on glutathione content of colonic mucosa, evidence for oxidative damage in active ulcerative colitis. But they don't know about there's that functional glutathione that works. And the changes they felt were because of the inflammation. Anything you can do naturally to reduce that inflammation. That's what they're trying to do with all these drugs. You use glutathione, use our varsod, use a NAC from Designs for Health, and phosphatidylcholine from Designs for Health. I like this bottle because most patients I put on 1 a day or 2 a day when they get good, or sometimes 3 or 4 a week. There's 180 in this bottle. It's a great buy, and it's probably the best form of it out there. Designs typically, they want to have the best product in the marketplace. We're going to talk more about them over the next month or two. We actually make some stuff for them, or have in the past too. And they are extremely difficult to make stuff for because it's got to be perfect. And that was right in our wheelhouse. So anyway, just throwing it out there. We'll put the link in here for the phosphatidylcholine, the Designs for Health NAC, the Designs for Health phosphatidylcholine, and the varoglutathione. And I try the varsod too if you have bad inflammatory bowel conditions. Keep me informed or call if you need an appointment or want to look at your genetics, and we can find them. This is Dr. Dan Purser. Thanks.